Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer, the Okoboji Wellness Clinic, where their idea is to not just have you survive, but to thrive. Good morning, Dr. Meyer.
Good morning, Dave. Glad to be back in the beautiful Northwest Iowa.
You have been out there getting some more learning under your belt.
It never ends, and it's certainly fun to do it with a group of practitioners, many of whom were traditionally trained. They're in this space of the creative zone and are working with tools that weren't all taught to us in medical school and are quote-unquote outside the box. Every time I go to one of these conferences, and this one was again in California, and was speaking to specifically ozonated glycerin, but so many other approaches to help heal the body. And again, you come back extremely excited with new additional tools. I think of the guests that have been into the clinic, and that I may like, oh wow, I think this really is going to maybe help them get further down the road. So it's a fun space to be in. It's life-giving, and certainly blessed to be on the mission.
Ozone is something that this is the thing, is what's old is new again. Ozone's been around a while. Hyperbarics had been around a while. Some of these things are just being uncovered, I guess, maybe is the right terminology for just how valuable they are. True.
And part of them have just have been lost to the dustbins of science and such. Again, the ozonated glycerin, there's a book on ozonated glycerin in the Library of Congress, and it's a national treasure. You can download it for free online and learn more about all the applications of ozonated glycerin. And so that's one example. Of course, many. The ozone impact and hyperbarics, for that matter, have been utilized a lot in Europe, and that's over the last 30 to 50 years. It didn't seem like the pharmaceuticals in Europe, and maybe it was a difference in insurance, but it didn't seem like in Europe they maintained a broader set of tools outside of just pharmaceuticals in Europe. And now it seems like while that continued overseas, a lot of what's been over there the last 50 to 75 years is coming back to this country and being looked at again by healthcare professionals, and we're applying those things. And we need to. There's one of the most amazing eye-opening lectures on the last day was talking about toxin exposure, and it was incredible the amount of inundation. Of course I knew, but he brought it up in how many different ways, from the clothing we wear to, for instance, bras, to the microplastics in that, even if you're drinking Fiji water or you're drinking Evian water that is going to maybe be a little bit better choice for you, the microplastics in that are a factor, or the phthalates and the cookware that you use. So you start to realize, wow, okay, we really need to be thinking about on a continuous daily basis of how we detox the body and give the body what it needs. That's a 24/7 job just because of what we're exposed to on a daily basis. Again, the processed foods. Our bodies are working overtime now. Medical science has found incredible ways to extend life, but again, the quality of life is where we need to continue to improve that data of it today, thriving, and that is by looking at chronic disease, oxygenating the body, working on detoxing the body, getting away from these as much as we can exposure to these toxic compounds. And then we can really make some beautiful progress on again, the body's incredible capacity by itself to get into that healing space.
So I think COVID had a great deal to do with how we traditionally looked at medicine. So I think if there was anything good that came out of COVID, It was this path that developed that you and a lot of other doctors are undertaking. And now I think something else is going to lay at your doorstep, and that is going to be the explosion of the price of health care, especially Obamacare, going up a tremendous amount because it looks like they might pull the subsidies out of there. And so that really makes that direct primary care model look extraordinarily affordable.
Yes, absolutely. The catastrophic insurance, the emergencies, again, having these systems in place are important. Things like the ER and emergency surgery surgeons and such. But the chronic disease management, and yes, I mean, I've seen it myself for my family, and we've all recognized the cost of our health care insurance go up. A nice thing to consider is that direct primary care model. It is something that has grown over the course of the last 15 to 20 years, and it's a nice, really good entry point for folks into our space here and to get to meet with us and start that journey. And it's a $99 a month for unlimited visits with myself, and that is longer appointment times. And then there are some services that are then discounted with the direct primary care. So some folks will come into the clinic here and just kind of pay as they go type of thing. It's called the a la carte. But for those that want to really come in on a regular basis to kind of see what we can do to get ahead of and make some progress in their health, the direct primary care model is a nice entry point. And I always come back to a couple of folks in Northwest Iowa that did exactly that. I mean, you can do all these additional things that are like extra supercharging to the healing process in many cases and getting the body into that better space, that thriving zone. But certainly, coming in and taking a more measured pace, a slower pace, getting on some targeted supplement therapy. We don't need to be on a ton in many cases, and just a targeted group of supplements that are going to be best for you. But meeting with other members of our team, like Molly Avery, who does our functional nutrition and detox specialist. Michael Sheridan is fantastic. He does the reflexive brain work, orthopedic massage. They both get absolutely incredible results. And so this is what we want. We want results. We want to get folks in and feeling better. And when you go down this path, again, that couple that came in from Northwest Iowa, that's the path they started on. It was the direct primary care membership. We looked at their labs. We did a few supplements, and we had them meet with Molly, and we did some lifestyle changes, dietary changes. I did do a few prolozone injections in the joint, which were impactful in a big way for them from a pain perspective. But beyond that, they hadn't gone down yet ozone or hyperbaric path or some of these other modalities, but they have had big impact on their quality day-to-day life. So again, there's a lot of different ways to get started here at the clinic, and our goal, we've got a very heartfelt, compassionate team that really cares and that wants to get people feeling better. And so it's a great group of folks I'm blessed to work with, and looking forward to more and more folks, like you said, that are kind of looking to maybe see if they can kind of get out of that just stuck phase and getting into that better quality, the day-to-day thriving. Mm-hmm. That's what we're here for.
A couple of things that I think is extraordinarily helpful at Okoboji Wellness Clinic. After COVID and I began following doctors across the nation, a couple of things that have really been extraordinarily impactful in their practices. You mentioned nutrition. Nutrition is just off the charts. It seems like the food pyramid was maybe built a little upside down.
Yeah, and I'm not going to disagree with that, but I'll let you continue, but I will say it's a foundational piece, nutrition. It's absolutely foundational.
It's huge. And that's one of the things you have talked about, inflammation so much. And if you are injecting in your body things that inflame your body by what you're eating, well, you're just hurting yourself. And then the other thing, because of your expanded appointment times at Okoboji Wellness Clinic, these people that, and I've been down this road, people that are on a dozen medications, you can sit and visit with folks and be like, why are you on this one? Why are you on that one? And you might be able to trim some of those medications. And over time, what happens, you go see the doctor and they say, no, I'm going to prescribe you yada, yada. And the next time you see the doctor and I'm going to prescribe you yada, yada. And before you know it, you're on a dozen prescriptions and you're not even sure why you're on so many.
Yeah, absolutely. And one sometimes is going to have side effects, and then another prescription to cover those side effects. And so that's, deprescribing or coming off prescription medications in a thoughtful manner with a physician or medical provider. It has to be done appropriately, but many times when you work on these foundational things to get the body back into balance in a space of healing, you can start that process when you give the body what it needs, what it's been missing, decrease the toxin load. You can see the body start to perform again in a way that's it's phenomenal. So, absolutely, I think that's a goal for many folks, Dave, is to not be on as many prescription medications as possible. Again, sometimes I think these prescriptions may, in the initial phase, may be intended to say, hey, this is a bridge while we work on this lifestyle stuff to get the blood pressure down, for instance, or the inflammation down. But sometimes the right tools or education hasn't been given to the individual for how to get to the point where we get into the space of the healing so that the body can come off of some of these prescription medications, for instance, a blood pressure medicine, and not be at risk because their blood pressure isn't so high because they've made some of these lifestyle changes.
Yeah.
So it has to be done in a thoughtful manner, but a lot of times too, you'll have folks that will, when they work through this process, being on less of these prescriptions. Again, I use myself as an example. I used to be on 4, and one of them was for heartburn. The other one, then eventually that affected my absorption in my gut and probably a decreased iron count, and then that led to restless legs. I had some of the worst restless legs you could ever imagine. Then I ended up going on a prescription called Requip for restless legs. And so that I was kind of going down the path, and so I get it, I understand it, and I, of course, have a better grasp for it now. So and that was not fun. It's like, these restless legs at night would just keep my wife up, and it would be just something else. So it's nice not to be kicking and restless at night now.
All right, so if somebody wants to talk to you about direct primary care or have a wellness visit or is interested in surviving or not just surviving but on thriving, what's the best way to get a hold of you and Okoboji Wellness Clinic? Maybe they want a discovery call and say, here's where I'm at.
Yeah, we're at 712-339-6024, 3305 Berquist Avenue in Spirit Lake, just off Highway 71. Very accessible. Again, we get folks coming from southwest Minnesota, southeast South Dakota, and some parts of eastern Nebraska, and beyond. And so we're here to serve and to get you feeling better. And that discovery call is a great starting point, just to kind of dip the toes in the water, get a little bit better idea what the initial start might look like. Again, that's a 15-minute discovery call that's complimentary, and I'm on the phone with you. And it'd be a privilege to to get to know more and more people.
Very good. Dr. Meyer, always a pleasure to visit with you. Have a great day. Welcome back home, and we'll chat again next week.
All right. Be well, everyone. Take care.
Thank you, Dr. Meyer. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.